Now, the Premier has indicated that a lockdown is all but inevitable and that he will be making an announcement tomorrow. Of course, top of mind is the alarming rise in ICU beds. They're up 49% over last week.
Our hospital ICUs are in jeopardy. Our long-term care homes are at risk. We have some difficult but necessary decisions to make.
The fear hospitals will be overwhelmed is becoming a reality even a week sooner than modeling suggested. Critical Care Services Ontario says there are 150 COVID patients in ICU beds. That's the point at which hospitals can't keep performing all surgeries. Doctors are sounding the alarm.
We're on a trajectory to have more COVID patients in ICUs than we did in wave 1. This means we're going to have to limit access to non-COVID related care, cancel surgeries, cancel cancer surgeries, cancel hip replacements, knee replacements. We don't want to do this. We can't do this. People will die if we do this.
Government data indicates close to 200,000 surgeries have been postponed since the pandemic began compared to the year before. Just how many deaths have been caused by the canceled surgeries is not available yet.
It is tragic to lose a family member to COVID, but equally tragic to lose someone because they didn't have a cancer surgery or cardiac surgery done in a timely manner.
That's why lockdowns in hot zones seem to be almost a foregone conclusion. As for what they could look like, the Premier gave few clues today and wouldn't say whether stores and malls will close again, although a government source says this time round will be different from the lockdown in March. Schools, for example, will remain open, even though in New York City they're closing schools because of a 3% positivity rate, while Toronto's is around 6%.
I've heard from numerous doctors, not to mention our health table too. The safest place for our children right now are actually in the schools.
What should a lockdown look like in the hot zones? Should schools close? Should stores close? Outdoor patios, should they close as well?
The best thing we can do is to be extremely targeted. There are very specific neighborhoods where we are experiencing severe COVID. And I think there's an argument to be made for closing stores and decreasing social interactions in those particular areas. But what we really need to do is we need to move testing resources locally. We need to engage with the local community. We need to cross language and culture barriers. A broad lockdown is really a Neanderthal approach that fails to take into account all that we know about COVID and how to prevent it.
Now back to surgeries for a moment. The health minister said today that they are looking at moving patients from hospitals that have no capacity to ones in other regions that do. But certainly the system is coming under great strain.